Hi everyone, I'm Lindsay Tyler. I'm going to be presenting on the article of the week, which is Development and Implementation of a School-Based Obesity Prevention Intervention, Lessons Learned from Community-Based Participatory Research. And the authors of the article are listed below. Why I chose this article. In my experience, school-based programs to address obesity are utilized all the time, but frequently fall flat of their goals, which I think are producing healthy outcomes in regards to obesity in adolescents. In my own community, I feel like every year we had some new kickoff for a program, and I don't necessarily think that it was followed through and accomplished its goals. So this article is interesting to me because I wanted to see how CBPR could enhance these efforts. I took a stab at understanding some of the problems in implementing um, school-based obesity programs today, and I found that usually school-based interventions are a top-down approach, whereas CBPR provides a methodology to engage all stakeholders to accomplish a unified goal. School systems also have many formal levels of approval. You have, the school district level, the board, the administrative, teachers, staff in cafeterias, et cetera, et cetera. Um, and it can be difficult to wrap your hands around all of those different stakeholders, but CBPR provides a way to engage all of those levels. I just wanted to run through a couple acronyms that are pretty prevalent in the article. I'll be using them for the rest of the presentation. The Los Angeles Unified School District is the LAUSD. UCLA Rand Center for Adolescent Health Promotion is referred to as the Center. Community Advisory Board is the CAB. Healthy Living Advisory Board is the HLAB. And in the article, they often refer to the leadership team. And what they mean by this is a team of investigators from both the Los Angeles Unified School District and the UCLA Rand Center for Adolescent Health Promotion. They had researchers come together from both of those organizations to form the leadership team. A couple goals of the article. One was to develop and test an intervention that was feasible for school staff to implement on their own, was cost effective and consistent with district and school priorities, and that LAUSD would ultimately choose to sustain going forward. Another goal, I think, was using current policies as a platform for designing an intervention that was consistent with LAUSD's policy goals and that aim to translate LAUSD obesity prevention policies into practice within schools by tailoring obesity prevention initiatives to fit the individual school context. I think that last part is what really drew me to the article, because they really tried to focus on tailoring the different prevention initiatives to individual schools instead of a blanket one size fits all. And I think that's what ultimately helped them become very successful in achieving their outcomes. So just to walk through the methodology really quick, they started with a community needs assessment where they held 14 focus groups. They interviewed 119 middle school students. They had 8 focus groups specifically with 63 parents, and those parents spoke both English and Spanish. They held 27 qualitative interviews with community stakeholders, and they did some on-site visits to collect qualitative data just from observations of regular processes in the schools, in the school cafeterias, in the gyms, etc. The second phase of the method was a pilot test. Once they collected all of that baseline data, they went to the community for input on the types of interventions that they would like to see. Once they randomly sampled some students to implement an intervention, this allowed them to collect some data and disseminate some early results back to the stakeholders so they could identify what was working and what didn't, and how they can tweak the larger program going forward, which I thought was really smart. I'd like to move on to the results and some of the lessons learned from this study. So the article broke up their lessons learned into some larger categories, and so I just want to highlight them here. Schools, especially those in large urban districts, have multiple levels of administration, which require multiple levels of buy-in. The article indicated that researchers should be cautious in assuming that they have broad community input or support unless they have comprehensively explored multiple stakeholder layers, which are sometimes only evident in continually revisiting and re-engaging partners. I thought that was really interesting because just because you have a group of stakeholders in a room, in a focus group, or interviewing them, that doesn't necessarily mean that you have their support unless they're continually updated and brought along through the process. So I thought it was interesting that they highlighted that you really need to do that to understand where your stakeholders are at in the whole process. The second one was communities, just like large organizations, have multiple levels of stakeholders with distinct differentials, requiring cultivation of separate partnerships for each stakeholder type. So 3 different advisory groups arose from this whole process, and each one was distinct. So the center's CAB was focused on adolescent health in one local region with LAUSD, including representatives from LAUSD, principals, parent groups, Los Angeles County Health Department services, foundations, businesses, healthcare providers, youth serving in organizations. The group really incorporated a lot of different types of individuals. The second one was the Youth Community Advisory Board, and that mainly consisted of high school students, and the reason they broke that out was because they didn't want the youth that was being engaged to feel like they were going to be dominated by adults or people in power within the school and community where they couldn't communicate what they wanted to honestly and openly. So they kind of tried to cut down on the intimidation factor, if you will. They hired a young facilitator and they did a photo voice project to capture what the students wanted to say. And a photo voice is a CBPR tool for identifying health-related concerns in a community by giving voice through photographs to people who are often not heard. So I thought that was a really cool way to capture the youth's voice in all of this. And then the third advisory board was the Healthy Living Advisory Board, and that had already started during the pilot intervention. That consisted of stakeholders in the Los Angeles County Department of Health Services, Department of Public Health, and other county level organizations. Implementation of a sustainable CBPR intervention requires common vision and shared priorities among all partners. So it was definitely imperative that in order for the study to prove successful, all partners were committed to the program goals. Individuals would work harder to sustain the program if they truly believed in it. An example that the article gave was that students were throwing out whole fruits, even though fruit was provided, whole apples, whole bananas, whole mangoes or whatever. Were actually being tossed more than eaten. So the cafeteria staff decided to dice fruit and make fruit cups and fruit salads to see if that worked. And it did work. Students started consuming more fruit, but it took the cafeteria staff an extra hour or more just to dice fresh fruit every day. But because they saw more students eating healthier as a result of this, the cafeteria staff decided to put in the extra time. So that's just kind of an example that people will work harder if they believe that the outcomes are going to be achieved. To influence policy change, it is important to understand schools' political and policy environments. So, the school districts often use policies or regulations to change school level practices or environments. However, policy change doesn't always translate into practice. So, the article mentioned that they found that there were existing federal regulations and LAUSD policies that were already consistent with the project goals. And that the project should be aligning their interventions with the district and statewide goals for obesity prevention. Um, just people didn't know that those existed. And so I get the sense that not only in this community, a reason why other programs fall flat is because they try to recreate the wheel instead of aligning their initiatives with initiatives that are already working towards the same goal. And the last lesson learned that came out of this article was that capacity building as an outcome of CBPR applies to both community and academic partners. So helping communities to overcome upfront costs or one-time hurdles really help the communities carry on this work. For example, when they wanted to introduce signage and labels for nutrition in cafeterias, the printing costs and the design costs, all of that was a one-time upfront cost, which was funded by the program. But even when the program funding ceased to exist, those materials will still be able to be utilized by those schools. And then another thing is helping researchers cultivate new skills in CBPR methods and train alongside community members. I liked how the article mentioned that even though less attention is traditionally dedicated to capacity building among the academic partners, they really noted that the experience to be involved with new skills coming from the community really helped to broaden their horizons and gave them new opportunities for community-based training. And that really speaks volumes that even the academics that came in and immersed themselves in CBPR found that they learned just as much as what the community learned from the whole thing. I'd like to move on to conclusions now. I pulled this quote directly from the author under the conclusion section. It pretty much sums up what they were looking to conclude, which was the lessons presented herein were derived from joint analysis of a CBPR project by community and academic stakeholders. Other CBPR researchers have similarly described the need to invest time and resources for partnership building and to translate research to policy and policy to practice, as well as the reciprocal capacity building that occurs. So what was interesting to me was the part where they wanted to translate research to policy and then extra step, policy to practice. So I think just based on my own observations of communities around me, there are a lot of policies that go into place, but they're never put into practice actually into the schools. So I think that's another reason they probably fall flat is we end at policy and don't take it that extra step into practice. So my assessment of the quality of the research. So there was definitely broad stakeholder engagement across all levels, which I thought was at the core of CBPR. I thought the sample size was pretty large, being that they use multiple schools, hundreds of students, dozens of different organizations within the community and parents, and use multiple languages. I felt like their sample size was pretty large and representative of the community itself. They also engage community members in planning, design, and data collection. So that was pretty big, that they kept everyone engaged the entire time. They didn't just bring them in for one portion or the other, and they developed feedback cycles. So that was with the pilot test. They pilot tested it and then provided feedback for improvement along the way, with continual support and input from community members. And I think the project in general highlighted how interventions can and should be tailored to each school's specific needs. And it's really important to, go into each school individually. They're each their own ecosystem with their own problems, challenges, and hurdles to overcome. And I think this kind of highlighted that you have to be equally as engaged in each school individually, and you can't just go into one and assume that's going to work for all. So I thought that was really cool. One thing that I thought wasn't super awesome was I noticed that the leadership team that directed and made all the executive decisions didn't necessarily include community members. It was all just the academic people on the leadership team. The article did make it sound like input on decisions were incorporated from the community at all points, but I'm not sure that we could necessarily verify that that's true, but I hope it is. My general take on the project was I thought it did a great job at facilitating collaboration across all necessary stakeholders. I can see how there were so many and one could get overwhelmed with how to engage all of them or leaving people out, but it seemed like a pretty open recommend who you think should be here and they are welcome to come, and I thought that was pretty cool. I thought it was interesting that many school districts may not be afforded the opportunity to take on such a large-scale intensive project. So the reason this community got the project underway was because they got a big grant to test it out. And so I think maybe the lack of grant funding might limit progress elsewhere because the engagement process was so intensive that I'm sure there was a good amount of funding that went into the startup and funding all of those people. So that might hinder some other school districts trying to follow in the footsteps. And this school district, it was mentioned in the beginning of the article, it was already kind of ahead of the curve on obesity prevention. There were already some policies and prevention strategies in place. So it sounds like they were able to build off some existing projects. And so I was thinking maybe this could also affect replicability across other school districts that might have nothing in place. They'll be starting from square zero, where these people might have started from square two. So I think that's definitely something to consider. Just a couple discussion questions for everyone. Do you think it's feasible for other communities to replicate this type of programming and engagement? It'd be really awesome if you could tell me why or why not. Why do you think that obesity prevention efforts in the United States aren't successful in achieving healthy outcomes for adolescents? What are those barriers that we see so often that perhaps CVPR could help fix, or maybe not? Maybe there's another way. Just your thoughts on that. And then do you think that it was a detriment to the project knowing that the leadership team did not consist of community members? Why or why not? All right, thanks everyone for listening. I'm excited to continue discussion on this with you all in the future.